Okay, we are going to continue with our essential sciences as I get myself organized here. And we are going to open our book. And so I'm going to share the screen and share and get to page first here. Ta-da! So let's do a little bit of a quick overview on what we've already done. So there is how we're going to open our book. And the last chapter we worked on was terminology. So if we look at our table of contents, what we have done now is the first unit. So my parakeets are chirping, and I still haven't decided if that is a correlation or causation because they hadn't done it before. So maybe I am causing them to chirp as I work on these support videos for your self-study. Don't know that yet. I haven't. It's a hypothesis. I haven't done an experiment. So, chapter 1 was the overview of the whole body. Chapter 2, unique in that it gave a real solid connection between massage therapy and essential sciences and how massage therapy might have benefit. And we also talked about pain and what health and well-being is. And so, important overview chapter. Then we looked at terminology. And so in this chapter, we had a lot of language, a lot of terminology. And so the study strategy for this chapter is to be able to begin to speak a language. So there is a level of memorization here. And in the videos that go with each chapter, the YouTube videos that expand this, our guest speakers, I actually found some medical terminology courses that you can commit to. And as I say that, I want to remind you that all of those YouTube videos, all of these videos, all of the chapter content, the online course, all of those are important in your own commitment to excellence here in studying your essential science. So that's on you. You need to schedule for that. And then our job, Luke and I as educators, we need to bring that into increased relevance as we teach you how to be a massage therapist and to be successful in your massage therapy practice. Okay, so now we're going to get into the actual systems, and those systems are divided up. We've got section 2, which is systems of control, and these are the 3 systems that a majority of massage therapy benefits through stimulating various sensory responses, then trigger the nervous system and the endocrine system to respond. So it's not a short story on massage benefits. It's a long story. And that is going to be talked about. We started to talk about that in chapter 2 when we looked at feedback loops. So now we're going to look at more specifics here on the nervous system. And then you can't talk about the endocrine system without talking about the nervous system and vice versa. So this is where we're going to target our study in section 2, unit 2. And then as we move on, just as a highlight here, we've got a whole segment on kinesiology and body mechanics. So skeletal system, joints, muscles, biomechanics. You can work ahead on these chapters using the YouTube videos and your online course. It's okay to be studying more than one chapter in the essential sciences. Okay, so let's click on systems of control and let's get a full screen up here. So chapter 1 is an overview of the nervous system and then the central nervous system. Chapter 2 is the peripheral nervous system. So we're going to separate out somatic and peripheral autonomic functions from the nervous system basics into its own unique chapter. And then, of course, the endocrine system. So let's look at chapter 1. So you should be aware now that at the beginning of every chapter, you look at the chapter outline. And you should also understand that each of these main headings is how the book is chunked into learning segments. And you need to organize your self-study in 15 to 30-minute sections and make sure you do all the activities in the textbook or anything else that is suggested, because this is a learning strategy for how you are going to be your own teacher and how you're going to transfer new material into long-term memory for comprehension and control. Okay, so this chapter has got a lot of language in it that you're going to have to learn. So here are your key terms. And then read through your learning how to learn. The metaphor idea of this is like that, that's a really good learning strategy. As well as with the terminology, things like flashcards and rote memorization. But this system also has a lot of concept and ideas that feed into mechanisms of benefit and physiological effects that massage therapy research is attempting to uncover. So now we get into our first chapter within a chapter, our little subsection. And typically when you've got overviews, you're getting parts and generalized function. And so do make sure you look at your pictures. And then we look at what are our subsection objectives. What are the things we're going to do in this learning segment? So generally, this is what the nervous system does. It collects data. It thinks about what that data is, and then it does something about that. So there is some level of critical thinking in the nervous system, especially if it's novel or new. But there's also habituation, or, oh, yeah, I know what to do about this. Oh, yeah, I know what to do about this, where information is not necessarily evaluated to see if it is even needed anymore. This happens with sensitization with pain. Then it talks about the two general categories, the central nervous system, which is physically located in your brain and spinal cord, and the peripheral nervous system, which is physically located outside into the tissues. Once it gets out of the nerves separate out of the spinal cord. And then that peripheral nervous system is divided into a somatic division, which is about movement and muscles, and an autonomic division, and also now an enteric or gut division. I think that most of the benefits of massage that are experienced in change of some feeling and function with a client are related to shifts in the autonomic nervous system. However, a lot of the messaging we're sending by pushing and pulling on the tissue is being processed through the somatic, the listening stations in the somatic nervous system. You know, how long is something, how short is something, how much pressure is on something, how hot is something, how cold is something. That's how we're sending the messages, but the adaptation is coming through the autonomic nervous system. And there's two parts to that, which is the sympathetic fight or flight, fear, and the parasympathetic, which is the rest, restore, renew. And then now everybody recognizes the enteric nervous system and how important that gut brain actually is. There are good descriptions of this within the YouTube videos in the guest lecture series that go along with this chapter. So here's a picture on how that separates out. And this one right here, the one of the human, we can actually see that nervous system, and we can almost physically touch it. I mean, we touch it through the skin, which is really embedded with listening stations, mechanoreceptors, touch receptors, that sort of thing. And we can press through the skin superficial fascia enough so that we can put a compressive stress onto these nerves. We can press them, and they don't like that. Nerves generally do not like to be pressed. Think of them as a worm. They're constructed very much like a worm, and they don't like that. So they need holes and tracks to go through, and the way the muscles are wrapped in connective tissue, and the way the bony structures are formed provides little roads and little holes, tunnels for the nerves to get through. And if there's a change in that, where there's a narrowing, then the nerve is going to be pressed, and nerves don't like that. So it's important to have a good idea of where the main nerves are. Now, each of these branches out into infinite little nervelets that cover the entire body, surface to very deep. These plexuses, right here is the brachial plexus. That's out. There's the cervical plexus, brachial plexus, lumbar plexus, and sacral plexus. Those are areas that are vulnerable to something changing in the shape of either the bones or the soft tissue structures, and they're prone to that compression. So here is the divisions and how they work themselves out. So this is a little schematic. So here's some words you have to understand. Afferent, connecting, efferent. A is first. We sense something first. Then it goes to the nervous system, and then we do something about it. So with my little dyslexia, I have a tendency to, these words look alike, they sound alike. So I have to find a way to remember which one is which. And then this review what you have learned feature gives you a structure to go back and reinforce this particular segment of learning. Then go do something. Go sweep the floor, or go weed the garden, or go shovel snow, or just go outside and take a 10-minute walk or something. Because you've been using your brain. I just said losing your brain. That can happen too. You have been using your brain, so to balance that out, you need to move your body. Okay, now we're diving deeper into the nerve cell structure. Read your objectives, your practical applications. And now we're going to look at language. We're looking mostly at structure here of neurons. So another level of language that you're going to have to be able to use. And it can get technical, it really can. And it can seem like I'm never gonna learn all this, but you will. You just got to keep using it. And we are not neurologists, so we might not have to totally remember what a Nissl body is, but probably we need to know what an axon is, and a dendrite, and the cell body. Synapse would be good, all right? And then various neurons, which is an individual nerve cell, they're classified by their shape. Now, very important is the surrounding, supporting, cleaning, delivering nutrient tissue in the nervous system. This often doesn't get the attention it deserves. So neuroglia, slow down, read this a little bit. Not that you would be directly tested on it, but more and more research is showing the importance of this information. So they create the environment. Now, multiple sclerosis is a pathology that actually attacks the Schwann cells, or the neuroglia around nerves. And so the nerve then isn't protected, and it doesn't fire correctly, or it fires too much, and then that creates the symptoms in multiple sclerosis. Then there's the question about, can the nervous system repair and regenerate? It can. It's slow. It's easily distracted. There's a lot of research going on with neural growth factors. When it's distracted, it can not necessarily rebuild the tunnel, and it can go off in directions that it's not supposed to be. And so you can get odd pain related to the nervous system. I fell on my knee quite a few years ago and probably cracked the tibial tuberosity. And when it healed with a little nerve ball. And if I lean on that just right, it really screams at me. And that was a misdirected healing response of the nervous system. Lot of research going into how do we help the nervous system regenerate and heal. Okay, review what you have learned. Then we're going to talk about, and this is something you have to have a general understanding about, how nerves actually function. So this is an electrical system. So there's a potential there, something triggers it, and then it goes back and forth between negatives and positives and negatives and positives. It's really pretty cool. It's not unlike, as using a metaphor, it's not unlike your own electrical system in your house. So it also has ways of moving faster. If there's myelin here, it insulates, and so the impulse, the action potential jumps. But if there's a nerve structure that doesn't have as much myelin, then it has to go through the nerve as opposed to jumping, and it actually is a slower transmission. Now, every time we touch somebody, we're making this happen. Now, the impulse that goes along a nerve, so it, as you're sending a message from one nerve to another, it's not a direct connection. The message has to be delivered here in something called the synapse. So, and it's delivered chemically, and those are called neurotransmitters. And so this nerve is sending messengers, the neurotransmitters, to this part of the synapse, this nerve, which then continues the journey with it. And sometimes the message delivered is a little garbled, and so if there's misinformation going in, then the response by the central nervous system might not be as appropriate. So this goes on and talks about that in more detail. Here's the names of those neurotransmitters, and there's a lot of them. A little stop here. There's been a lot of research on cannabis and endocannabinoids, and massage may actually influence our own internal cannabinoid system. That's pretty exciting. So you might want to slow down and read through this. And then we're going to talk about these messengers, these neurotransmitters. And a neurotransmitter is in the synapse, and a hormone is in the bloodstream. But there are chemicals, both are chemicals. There are chemicals that can do both. Sometimes they're in the bloodstream and sometimes they're in the synapse. That's where you get a lot of overlap into the endocrine system. So these are the major neurotransmitters. They're kind of exciting. It's very likely that a lot of what we do with massage in general is affecting this chemical soup here, which is what I call this, which then is going to affect behavior. And then now, as we continue down, then we have pain behavior and pain modification, which we're now looking at practical application of massage. So here's an activity, and we know that these types of activities are to support memory, comprehension and retention, and it's beneficial to do these. You're adult learners that shouldn't have to have a grade for you to do these. Okay, review what you have learned. Go take a rest, do a brain break someplace. And so now we are going to get into more language, more anatomy, and I'm going to dive into the central nervous system. So again, the YouTube guest lecturers do a really good job. There's 2, 3, or sometimes 4 YouTube videos that go through this with you. Same information, different presentation style, different voice, different pictures, and that helps with novel repetition. So we have our brain, which is a pretty cool thing. And then the various primary functions in that brain. And so you can read through that. And then more abstract, what is consciousness? A little practical application here. And how do we express our sense of consciousness with language and emotions and memory? What enlivens us? This table kind of tries to summarize a lot of that. This is fun. This shows the somatic and sensory area. Sensory would be information in, and how much we designate to our brain for processing that, and motor would be information out. So look at how much brain space is designated to the hand. Of course, that's what we primarily use that in our forearm. So when we do massage, and then look at here, related to the face and the mouth. Pretty cool. And then here's our motor area. This is the movement, and a little bit more even distribution than up here on where our sensory is at. So when we respond, so motor area is our response area. It's a more diverse body-wide, but still concentrated in the hand, the foot, and of course our special senses, touch, or taste, smell, eyes, ears. This box gives you some examples of how behavior could be broken down in possible neurotransmitters. It's biologically plausible here. And then another one here of consciousness and altered states of consciousness. And massage does create a change in consciousness or an altered state of consciousness. And that's a good thing. That's not a bad thing. So now you're learning, and so it would be good for you to pay some attention to how we learn. And then we get into the lower brain areas, the more reflexive responses. That's fun. That's a picture of Laura from years and years and years and years and years ago. The importance of sleep. Sleep is so important. and what it does for the brain and the central nervous system, as well as supporting um, renewal and regeneration. And then we get down into quite a primitive area of our brain. And we do a lot of functioning down there. If we had to think about every single thing that we had to do about contracting a diaphragm to do this with the ribs, and then we, you know, that we wouldn't be able to do that. So those become um, something that a system of control underneath consciousness is kind of taking care of. And then we have our coverings on the brain. Good to know these. For some reason, this is a common area where you're going to get questions on the MBLEX. The meninges, these ventricles, that sort of thing is talked about a lot in a type of manual therapy called craniosacral therapy. The research is a little iffy on that as far as the mechanisms that they actually describe directly related to these structures, but there's something going on. There's something going on there, even if it is nothing more than a good therapeutic presence and a sense of support and connection for a period of time. And there could be more. Now, our brain ages. I have recognized some of those, and when I had, that's my cat's tail. There it is again. So Gary, let's move Gary. So when I had the open heart surgery, I also had some secondary cognitive dysfunction related to, who knows, the surgery or whatever. And I noticed differences there, and I noticed differences as well now that I'm 60 plus, 67. And so with the brain, as well as with muscles, if you don't use it, you'll lose it. So novel learning seems to be helpful. So every time I have to learn to use another aspect of Zoom or another piece of technology, I keep telling myself that that's keeping my brain younger, more pliable. And then here are the divisions of the spinal cord. Do slow down, pay attention to this, because on a more mechanical level, nerve impingement, nerve entrapment, changes in thickness or thinness of tissue, changes in bony structure. This is where a lot of somatic pain does arise from. And then review what you have learned. And then the final segment here is pathological conditions. And in the YouTube section, I have a whole list of pathological clips, pathology clips, as well as pharmacology clips. And they're in no particular order. And the reason for that is so that your little brain is surprised when it comes up, and it feels novel then at that point. But look for, in the pharmacology sections, look for central nervous system acting medications and how they influence things from mood and function and sleep and all of that. I take a Zoloft, which is a serotonin reuptake inhibitor, and I am better able to control some of my OCD tendencies with that. And it functions as a neurotransmitter supporter. Doesn't make serotonin, it doesn't provide serotonin, but it does keep the serotonin in the synapse longer. And then we get into these various pathological conditions. So stroke, cerebral vascular disease, aneurysm, central nervous system trauma, concussion, cerebral palsy, spinal cord injury. Read the indications and contraindications for massage. Stop and think about what you would do, how you would need to research more if you had a client with cerebral palsy, for example. How would you use Medline Plus to learn more about cerebral palsy? How might you use PubMed to find research that might give you some information that you can use to inform your decision about working with your client with cerebral palsy? Every client with cerebral palsy is different. So you can't use a recipe with this. Same with spinal cord injury. I mean, it's all over the place. So while we can make some generalizations, when you get to your client, how were they affected uniquely by the injury? How have they adapted? What treatments are they using? All of that goes into critical thinking, and then our clinical reasoning plan. How are we going to approach the massage? A lot of the tumors are related to the neuroglia as opposed to the actual nerve cells, so that's kind of interesting. Also, various types of body cancer conditions, they'll metastasize to the brain. They'll move, some of these cells will move into the brain. Then we have degenerative disorders. There's Alzheimer's, but that's just one of the many types of dementia that can occur. So explore other types. Medline Plus is great for that. We also have electrical activity problems, which would be seizure, tremors, and Parkinson is a electrical neurotransmitter issue. And we have chorea, Huntington's, which is a genetic disorder. Now, headache can be musculoskeletal, it can be chemical, it can be gut, but sooner or later the nervous system is involved because it's pain and or discomfort, and so headache may also be classified as a musculoskeletal type issue. So most of these, though, will come back to an interface with the nervous system. Then we have depression and anxiety, which are more of a mood, neurotransmitter, behavioral thing, and there's a lot of variation in through here. And when we get into any kind of pathology or dysfunction, it's good and important and helpful to have an entire health care and medical care team, interdisciplinary, that is working together. And so we might not be, certainly we're not going to be the one that provides the medication, nor are we going to be the one that provides the counseling around it that might be with one of these mood disorders, like cognitive behavioral therapy. But we need to understand what other treatments are doing, what is their potential mechanism of action, so we can make good decisions about how massage might interface with that. Schizophrenia is common, um, and they're trying to unravel what that is. And I have worked with clients that have a diagnosis of schizophrenia and may have had the audio or auditory or visual hallucinations with the paranoia that went with it. And it wasn't my job as a massage therapist to change those perceptions. That was the psychiatrist and the psychologist's job. The clients that I had with schizophrenia and or anxiety and depression, I had headaches or low back issues, or they couldn't sleep very well, and that's where massage was focused with that. Now, there's really good evidence to support massage for helping people manage anxiety through managing the stress response. A little less for depression, but really good for anxiety. Then we have infectious disease. These can be sneaky. And so if somebody has an odd sensation in their head, they've got a pain they've never experienced before, same with a stroke, these, that there's a change in mental status, any of these other conditions right in here, that can become a medical emergency and requiring either a referral with urgency and or even a 911 call. So there you go, review what you've learned, pay attention to all the guest speakers on your YouTube videos. Do spend time unraveling this scenario based on critical thinking and clinical reasoning. Gives you some guidance on what to do with that. And for HEC students, this is on Canvas for you, and on Evolve. It's under content update along with the test questions. Work these through in even small groups. A lot of learning occurs here. So don't ignore these. Same with the multiple choice questions. The factual recall questions reinforce your terminology, and then the concept identification and clinical reasoning, they pull it all together, and you need to use critical thinking to be able to choose the best answer and write your own questions. Make sure that your wrong answers are plausible, and justify your right answer. Really, really good. And share those with your classmates. And you can help quiz each other on this content. Okay, so that's the overview. Let me get out of screen share. That's our overview for this chapter. And the next chapter, we will delve into the autonomic nervous system, where you really do have to have a nice understanding of functional capacity with that. It doesn't have the physicality, it doesn't have as many structures that you can sort of touch concretely. But it's really fascinating. It's really fascinating.